listen.
That's so silly.
Skinny people talk. I recently posted something and you did reply to it. And I was like, why, if we have people that are dealing with like 15 pounds their whole life, 15, 20 pounds, and forever, and then they had a wall and it just ain't coming off anymore and it's packing on anymore, right? And then I wrote something like, we can't see food noise. Like, why are we treating people like this if we can't see food noise? You know what I'm saying? Like, why are we looking at them and going, they look skinny to me, so obviously they're taking this for vanity reasons. Like, why is that okay? And especially if they have something else going on metabolically, right? Like, we don't necessarily understand it, you know? And you were like, yeah, because it's insulin resistance. And I was like, oh, so can we talk a little bit about that? Like insulin resistance and people that look skinny?
Okay. So, but one of the things, okay, we'll talk about it, but also,
Okay.
thinness does not mean you're healthy. There are people
Yeah.
who have fatty issues even though they're thin. So you can have a fatty liver, and a GLP-1 will address that fatty liver even if you're not overweight.
Yeah.
So GLP-1s are not just for weight loss. I mean, I don't know why people even care, to be honest.
Honestly, right?
No,
Come
really,
on.
and it really has nothing to do other than bias and prejudice. It's just, I
Totally.
think
It's a sexy news story.
having hatred towards people who are overweight is the only acceptable prejudice now.
Yeah.
No
Oh
other
my gosh,
prejudice
so
is
true.
considered socially acceptable,
Acceptable.
except laughing at, insulting people
Yep.
who are overweight or
So
obese.
true. Like even like autism, like, I mean, disabilities, not
No
acceptable,
better,
race, not acceptable, culture,
better.
different culture difference, religion, not acceptable. But you
Accents,
can call people fat all day long.
but
Accent.
you
Yeah.
can have people, doctors, posting
One of your favorites, Dr. Toomer?
posting clips of a woman who's who's overweight or who's obese being insulted, and it was considered funny. And my thing is, no one gets to 600 pounds for no reason, and it's not food.
Totally.
It's
Yeah.
not food. And the thing is that I have never met anyone who is that obese who hasn't had some childhood trauma. In fact,
100%.
I screen for childhood trauma because there is such a correlation between childhood trauma and obesity.
Totally. Yeah. We
Especially,
for sure have seen that on the show with people that come on.
especially,
Almost all of them.
yeah,
Yeah.
sexual abuse. And so
Yeah.
there's just, and it's just in varying degrees. Some people, and this is the crazy thing, we look at people who are underweight, who are anorexic, we realize there's a psychological issue there. But for some reason, when we're at the other end of the spectrum, it's food. How?
Yeah.
How is it food on one person and not psychological, but it's psychological for the other person? And the
Yeah.
lack of food. We understand a person's not eating because of psychological issues. Have you ever thought that people eat because of psychological issues?
Totally.
They're
Yeah.
on the same continuum. But again, bias, prejudice allows us to say, if you're over, it's your fault.
Totally.
And I forgot your question.
Oh,
No,
dude,
that
I
was
was
kind
gonna
of
be
it.
selfish
Like,
to ask my question.
oh yeah, let's ask your question, Kat.
Well,
We knew we were gonna flow. We knew we were gonna
it
flow. with
flows
something
like it
together.
flows right into it.
Yeah.
So I caught your TED talk, your TEDx talk from 2020,
Yeah.
imposter syndrome, and you got a great twist on that. And it made me think of when we had Dr. Contessa on and she talked about depression really being a big root of obesity. And all of us are going through a transformation and changes. And I feel like maybe that could be a little bit of an imposter feeling. Do I belong in this size? Do I belong in this environment? And you mentioned the book, and I'm going to have to pick it up, Chatter by Ethan Kross, Managing Your Negative Self-Talk. So in your practice, when you encounter patients like this struggling with it, do you have any tools that you pull out of your back pocket and have ready for us, the patients, to handle?
Well, one of the things I did is I got certified in neurolinguistic programming. And what that does is it helps people reframe their language. So if I hear something negative come out of someone's mouth, I reframe it and throw it back at them in a positive way, which is one thing that I do. But the other is gratitude journaling. Keep a journal. Write down every day, just write down 10 things that you're grateful for. And what happens when you do
Yeah.
that, over time, what ends up happening is you start looking for things to be grateful for.
Mhm.
Yeah.
And it sounds really woo-woo, but it works. And really,
I love
your
it.
brain is a muscle. It's neuroplastic. It can change. You can change the pathways of your brain, but you have to train it. And the way you train it is by doing the same thing over and over and over and over again.
Mhm.
And so, yes, the other is being honest about my own struggle, so that people don't feel like they're by themselves and they're
Yeah.
alone. So then because the isolation makes anything worse. So if people realize, if you normalize something and you give people permission to have it, then suddenly the stress the cortisol spikes, and the stress and the self incrimination stops. And so it makes whatever is happening not as bad. It's not, it helps. So telling people, yeah, I mean, I've cried in dressing rooms because something didn't fit, because it was too big, and I mean too small. And I've cried in dressing rooms when something was too big,
Yeah.
because I
Totally.
wanted it too big. And so, and I was very ashamed to admit that for a long time, because I'm like, those. I just remember when when I was, very overweight, and you have this, little skinny person say something about, oh, I can't do running, and you just want to smack them. That's how I felt like I was one of those people. Like, don't become that person that other people want to just smack, and you're like, I hate that I have to wear this size, So I mean, some of it is that, and I realized, though, but by keeping it to myself, by keeping those feelings to myself, I was doing other people a disservice, because for me it's this weight. Other people, it could be a different weight. So it does. It's the feeling. It's not the size that matters. And so so when it comes to imposter syndrome, one, I don't believe it exists, mainly because it's a self-imposed.
Mm.
It was a very interesting TEDx talk, guys.
If you don't say you have
Wow.
it,
Yeah.
no one else can tell you have imposter syndrome. You have to tell yourself you've got imposter syndrome. So if you don't tell yourself you've got it, you don't have it.
Oh, I still tell myself I've got it. Still.
But my thing is, but it's the same thing as telling yourself if you're thin, or telling yourself you're fat, or telling yourself ugly, or telling yourself you're dumb, or telling yourself you're whatever you tell yourself, you become. So stop telling yourself the thing, but it's a muscle. You've got to work on it. It's practice, and it takes practice, because often those voices were created by other people towards us as we were growing up, and so then we just carried on later in life.
Yeah.
And or we heard them telling it to someone else who now we look like.
Yeah.
So as we get, so when we were little girls, we heard other women being told certain things, or we heard other women saying certain things, and we didn't. And so by the time we became women, that their voices, their insults, that became ours.
Yeah.
We, children pattern. And so, so it's just really, 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 really important to pay attention to how we speak to ourselves. And so I do a lot of exercises with my patients and clients, and I'm constantly cutting them off mid-sentence. I can't, no, wait, what? And they're like, okay. I mean, if people have worked with me for a while, they know they start and then they stop. They're like, wait a minute. Okay, let me reframe this.
That's
they just,
good though.
yeah. And so really that's all it takes. That's really all it takes. And sometimes it takes medication to help you get there. Because for me, it takes antidepressants. Otherwise, my filter is so skewed. There's nothing you could tell me that would convince me that I'm all right.
Yeah.
I get it. I get that.
Totally get it.
It segues into like the second question I had. When people think that, like, we're speaking of these GLP-1s, they think they're a silver bullet. But I know, because I've gone on a journey of therapy as well, but there are pillars, there's pieces to the puzzle that put together obesity management. And what are your pillars? What are the pieces that fit together to make everything work cohesively for you?
One of the pillars that for me, what I see most underlooked for everybody that I work with is stress.
Yeah.
For a couple of reasons. One, as women, we've been taught to ignore it. We don't even recognize it when we're under a lot of stress because it takes a lot for us to get to the point where we feel it. Our body feels it way before we do. And so paying attention or having a very active, very targeted, very intentional de-stressing mechanism of some type, daily de-stressing. Or for me, it's I have a breathing exercise I do. If I'm, I can be anywhere. I'll do it. Sitting in the car, trying not to fight with my husband, whatever it takes. I just breathe. And it's yoga, deep yoga breathing. So that's one of the first things I notice is that, that's the most important pillar is being able to manage your emotions, either
Yeah,
through,
totally.
through whatever you have to do use all tools at your disposal. If it takes medication, it takes medication. If it takes therapy, it takes therapy. If it takes, walking by yourself and just, telling people, look, if you don't want me to kill you, let me go for my walk right now.
Absolutely.
Whatever it
Absolutely.
is, just, having boundaries, setting boundaries
Oh, yeah.
but not only just setting boundaries, respecting other people's boundaries.
Yeah.
But at home, in your job, teaching your children to respect your boundaries so they understand what it means to respect boundaries.
Yep.
Because we're so used to dropping everything for our kids instead of making them learn how to wait. I'm guilty of that. But now
Totally.
my children are in their 20s and 30s. So when they call and I don't answer, it's like that TikTok video. How dare you not answer my phone call? When they call their mom.
I love that one.
Yeah.
We trained our children to expect us to drop everything when they call.
Yeah.
Yeah.
So that's one pillar. The other pillar that kind of feeds into that is the mindset work, the mind work. Learning how to defend your choices. Learning how to give yourself permission, one, to want what you want. Who cares if it's to lose weight? Who says that losing weight is shallow, superficial, and an inappropriate thing to want?
Yeah. Who cares if it is? Like,
My thing is this. Yeah, who decides?
yeah.
Who's the determiner of what is acceptable and not acceptable in my life? Me.
Yeah.
So if I want to lose weight, I can lose it, and it's none of your damn business. If I want to gain weight, again, it's none of your business. Or if I am gaining weight, again, it's none of your business. My weight up or down is none of your business.
That's what we're going to call this episode. None your business.
It's none of your business.
That's a great idea.
PCOS and none your business. None ya.
And I see it a lot. One of the reasons actually I even joined TikTok was because someone said, we need people with your voice on TikTok because there's so much out there that's just junk. And people are following stuff that's dangerous. And like, we need someone who's willing to spar, like who's not afraid of confrontation and who's not afraid to just say, that's bullshit. I'm sorry.
Yeah.
And so, everyone, because Dr. I don't want people to think I'm angry, or I don't want people to think I'm that doctor who does XYZ. I don't care. Be mad at me if you want, but I'm going to tell you the truth. And that's how I started off with Dr. Toomer telling you the truth.
Yeah, telling you the truth.
Oh, this is ridiculous. But I did join. And so then I started seeing the shaming. I've always been an anti-shamer. One of the things that was the cornerstone of my program, the cornerstone of what I do is that it has to be comprehensive and it has to be compassionate. If it's not those two things, I don't want it. There's a fine line between being honest with someone, being direct, and being insulting and adding to the shame that someone's already feeling. And not all physicians know where that line is. And they cross it way too many times across the board. And it happened to me. Catherine, you should have known. For goodness sakes, you're a doctor. How the hell did you let this happen? I actually had one of my physicians say,
I remember that you saying that in our last, just
how
shamed
did you
you.
let yourself go that,
Yeah.
get this far? And well, one, I have a husband who's just like, I don't care how you look,
Yeah.
you're smart. That's all I care about. And so I never had that reflected back at me, was never reflected back.
Yeah.
In fact, the only thing that got reflected back is my 3-year-old, when I started losing weight, she was like, Mommy, you're not squishy anymore.
Oh, yeah.
How
Like,
sweet.
"Oh, I wasn't squishy."
Ren says that too.
You
Yeah.
know,
My little
and
guy.
it's like, but so I never really thought about it, but I only thought about it in terms of health. And that's one of the reasons why I've actually stopped using the term weight loss and use weight health. And the reason is because I actually have clients who I'm helping gain weight. I have clients who are not overweight at all, but they're what I'm helping them do is shift their body from their fat to muscle ratio, because that is healthy. I do not do any, and people like, well, and I help people. I watch for too much weight loss. I never ask people how much weight they're losing.
Wow.
Always, how are you feeling? How much water did you drink? How much protein did you have? How much sleep did you get? How are you getting along with your children? Is this process affecting your relationship with your spouse or your significant other? How are you doing with work? Is this a struggle? Whatever. That's all important. Those are all the things, going back to the pillars, those are all the things that are way more important than the actual number on a scale. So the only reason I ask people what their weight is, just so I can make sure they're not losing too quickly. Because if you're losing too quickly, you're losing muscle. And it doesn't give you time for that psychosocial adjustment to happen. And so you're more likely to sabotage your process if you start losing weight too fast. You need to be able to look at yourself in the mirror and still recognize yourself. And if you lose weight too fast, that goes away, and it scares the hell out of most of us. And you don't want that to happen. So it's better to slow someone's weight loss down so that they can actually continue and have a healthy result, psychologically healthy, physically healthy, socially healthy, rather than doing it quickly and saying, woohoo, you just lost all this weight, but you're miserable. Your friends have turned on you because they're like, who do you think you are? You're changed. You've done it. Even if you haven't changed, people are going to tell you you changed because they know then this has social currency. So they just assume that you think you're better now.
Yeah.
It's just the craziest thing. So doing things slowly gives you time to adjust. And so, so I warn people right from the beginning, listen, if you want something fast, I'm not your person.
I love it.
So earlier you said something about how 9 times out of 10 that it is hormonal why people are gaining weight. See, when I kept going to the doctor because I gained like over 65 pounds in less than 9 months, and everybody just kept telling me I was eating too much and not working out, and all of the things that we've come to hear that providers tell you. What is something that you do as a medical provider to rule out the hormonal factor? Because it took until I had, trigger warning, miscarriage to actually get diagnosed with PCOS. And even after the PCOS diagnosis, even after postpartum, there was still no provider willing to actually treat that disorder aside from throwing birth control and metformin at it, which didn't work.
Which up until recently, that's all we had, to be honest. So
right.
In all fairness, before GLP-1s came out, we really didn't have much else. But what I do is I do a glucose tolerance test, and I do a glucose tolerance test and a free insulin at the same time. So that way, with PCOS, you have this huge overshoot. When any type of glucose challenge, your body just goes haywire. And so I always look. The problem we run into is too many doctors keep getting fasting labs. Fasting labs tell you nothing. When you have a condition that's food related, you've got to have eaten so we know what your body does.
Right.
So challenge it with glucose. So what I always tell people, because sometimes even if you go in and you tell people you're not fasting, the lab tech won't even draw your blood. Even
Right.
if I put in the orders non-fasting, they still won't do it. So what I
Right.
always tell people, look, just tell the folks you're fast. If they say, have you fasted?
Yeah.
Yes. But make sure you drink that juice right before walking in.
Right. And
So
it's
that
interesting. And it's interesting that you say that too, because I mean, even when I went to go get like my gestational diabetes test,
Mhm.
I mean, they were actually concerned that I had low blood sugar,
Mhm.
like while doing that fasting,
Mhm.
you know, with the
But
drink,
that's
with
what happens.
the juice.
Early
so-
insulin resistance causes really low blood sugars.
Yeah, that's interesting. See, I had no idea about that, because
Yeah. So what happens? What happens early on? Because what happens with insulin resistance is that your cells cannot use insulin to get what you eat into the cell so that the cell can make energy. So when the cell's resistant to insulin, your body thinks, oh, it's because I don't have enough. So it just keeps making more and more and more and more.
right.
Yeah.
When that mechanism starts off, it makes more, but it makes too much, and so whatever your blood sugars bottom out, and it's only later on that it starts causing your blood sugars to rise. So that's one of the mistakes that a lot of doctors make. They'll check a hemoglobin A1C and it's like, it's 4.8. To me, that's a sign that someone's has been getting way too much insulin in their system, and that's why their average blood sugars are so low.
Yeah.
But
See,
and then the problem is, it's also our training is inconsistent. So I was trained at the University of Florida at Shands.
oh, that's so funny. That's not very far away from me, and that's actually where my stepdad did his residency.
Really? What field?
He's a nurse practitioner now, but it was back when he was just doing nursing. He worked at the emergency room
Emergency
up until
department?
maybe 2-3 years ago.
Oh wow. Yeah,
Yeah.
well, I was there years ago. Anyway. No, I graduated from my residency in 1999. And so as I say, we're the class of Prince, but
Yes, ma'am.
yeah.
You see them all back here.
I toured Paisley Park in May,
Oh,
How'd you like it?
which was so cool.
That would, yeah,
We are Prince people here.
Yes.
That's one of my
Welcome.
biggest
That's why
regrets.
everything's
Never
purple.
having
Hold on.
seen him in concert.
I'm gonna pull up my Under the Cherry Moon poster.
But one of the things that happens is that when you're in a teaching institution like Shands, and they're on the cutting edge of everything, you learn about the cutting edge of everything, and everyone takes about 10 years to catch up before it spreads, because they're doing the testing. We're learning it as it's being tested, and then it takes a while, then it gets published, and then it has to be peer reviewed, and then it has whatever. So then finally we say, okay, it's evidence-based, but that can be 10 years. So I was taught to be really aggressive with diabetes. Like, you treat it before it becomes diabetes. You don't wait till someone's diabetic to treat it. But I see this so often. Oh yeah, my doctor. I'm. What happens is I'll get a lot of calls of people saying, I need you to help me lose weight because I'm pre-diabetic. It's like, you need to lose weight because you're pre-diabetic. All you got to do is treat the diabetes.
Yeah.
And that's it. And so people, and honestly, I mean, I get even within my family, it's like I'm a miracle worker, and I'm like, well, not really.
Wait a minute.
JT always has to have her Mounjaro scolding pen.
No,
Listen here.
But
that's my
so,
agreeing pen.
Yeah,
I know, but like when you're fussing, you also go.
Oh yeah.
But, no, but really,
Multi-purpose.
and that's one of the things that I'm really adamant about, is how giving people the language to defend themselves, because we have been shamed for so long, we have been put down for so long, we often don't even know how to defend ourselves in general. So when you have these people who are just coming at you, who've never had a weight issue in their lives, telling you what you should be doing in order to lose weight. And so my feeling is always that, like, it's an easy way out. Well, yeah, so is driving. So, walk your ass to the grocery store.
Yeah.
I don't understand, when did making things easier suddenly become a bad thing? It's only a bad thing when it's obesity. And so so what I always tell people is, if the only time you have a problem with treatment is when that treatment is for obesity, then you're just prejudiced. It has nothing to do with the treatment. If you don't care if hypertensives get treated, if you don't care that diabetics get treated, if you don't care that cancer patients get treated, then why do you care that obesity patients are treated?
And that's also like something that I've been talking about on my page a lot, is that people are not acknowledging of PCOS can lead to diabetes.
Oh,
Staying obese leads to cancer. Like, they're not understanding that if you just allow it to, if you just continue to allow this train to keep going down this track, it could be fatal.
Yeah.
And doing preventative medicine shouldn't be shamed. It should be celebrated, considering the other long-term side effects. Like, people are so concerned about the side effects of the medication, they're not concerned about the side effects of
they didn't
not
care about
taking the
side effects
medication.
when it was diabetics. I never heard a word about side effects when it was diabetics. But this is the thing. And where people say, well, the people I know who are obese because they eat badly and I watch how they eat and whatever, because they don't realize there's a biological reason for those food choices. And the same biological reason for those food choices are the same reason why when they eat, it turns to fat instead of fuel. So I mean, I just kind of ram this home. It's always biopsychosocial. If you want to know why, you have to know all three, and you have to address all three, because if you address any two and not the third, that third is going to derail the other two. And so, but it's just like, sometimes I feel like you're just screaming into a void. People just don't want to hear it. They just really don't. And it's like,
maybe it's easier for that. I always say it's been easier for us to be like a butt of jokes, or it's just easier to pass off judgment, and that's just always how it's been. And then you have to reframe the way you think, and that's a lot of work.
It is a lot of work. It's a lot of work. And the thing is, there are a lot of people who really enjoy the social superiority they have.
Totally. Then
So
privilege
they
is the
don't
thing.
like it when they start losing what they think is that superiority. And so they really will, I mean, they will derail, and they'll do things, and they'll hound you, and they'll, oh, I can't believe you're doing this. And it's like, so you're okay with me being in a state where I'm unhealthy, and where not just necessarily because of weight. And let me just be very clear.
Sure.
You cannot look at someone and tell they're healthy or not because of their weight.
Yeah.
You just can't.
It's just like you said about Lizzo, like how active she is and all these different things. Like, I know you love her and you've been to her concert, like, and you're like, weight doesn't have a size, or no, you said health doesn't have a size, right?
It does have an expiration date, but it does not have a size.
I love it.
So, and I watched her. I mean, I was out of breath watching her on stage. And not only was she jumping around, then she starts playing the flute. How in the world did you jump around that much and have the breath control to play a
wind instrument?
And so, it's like, you just can't tell me. I mean, she's healthier. I don't care what our size difference is. She's healthier than I am. There's no way I could do that.
No.
So, I mean, it's just, we just have to change the language, but not just the language of other people, not allowing what other people say to us, but what we say to ourselves. And and it starts within us. And like I said, whatever tools you need to do that, whether it's medication, therapy, changing your friends, because something I always say, sometimes the weight you have to lose is not your own.
No.
It's somebody else. Or it's whatever in life is weighing you down. It has nothing to do with the number on the scale.
I get that.
Wow.
So sometimes that's the weight that has to be lost. Sometimes it's in the form of a spouse. Sometimes it's in the form of a mother-in-law. Sometimes it's, so
it's true. I mean, and when we're on these journeys, people start to look at you differently, and they start treating you differently. And I've noticed it. And I'm pretty sure maybe all of us have our own stories about that, because now, like you said, skinny is currency. And when people feel that you're getting to their currency, getting to their money, there's, something. But but Dr. Toomer and I, and I think Ashley, Kat, Kim, myself, we see it, especially on TikTok, where people come into our comments or they come into our lives and they, ask about the side effects. That's the very first question. And then they're, like their next question or their next statement is, well, I'm afraid to start because of
It's not the side effects.
the side effects. So
The side effects are the excuse, but that's not the real fear.
I didn't think so.
That's
What
not
is it?
Look,
and the thing is, though,
I didn't think so.
the thing is, again, that's someone
The
else
tea.
hitting on someone else's language, someone else's issue.
Yeah.
They're being told that side effects are an issue when really the fear is failing. The fear is losing the weight and it coming back, because most of us who've ever lost have done it multiple times, and that is the fear. And what the fear is, and one of the things that is the fear is the people around them saying, "Hi, I told you it wasn't going to work. I told you what's going to
That is
happen
a
when
big
you
fear.
come
Yeah.
off.
Oh,
You don't have to
my
come off
God.
because it's treating an underlying condition, and that underlying condition is still there. Then you continue to treat it.
Yeah.
That's it. Period.
And that's what I've been telling people lately. I've been saying, are you afraid of the side effects, or are you afraid of the side effect of staying how you are? What scares you more?
Oh,
What scares you more?
Ooh,
Like,
look,
It's not. And so what I
feel
tell
like I'm
people about
about
the
to
side
jump.
effects. So this is what people say.
I
Well,
could tell.
what about the side effects? And so I said, do you know the side effects for GLP-1s? No, because they always want to talk about thyroid cancer and pancreatitis.
Yeah.
I've been prescribing these for over 10 years.
Gastroparesis.
I've never seen either one with the medications. But what I always tell people is that read your Tylenol.
Thank you. I literally use that every single live. I'm like, have you ever read the black box
More people get
anything?
liver failure from Tylenol than whoever
Look,
get pancreatitis.
Another hallelujah.
Look,
Mob.
I say it in every live, Dr. Toomer, because I listen to you. Let me tell you something. When Dr. Catherine Toomer speaks, who listens? Janine M. Trott, and I'm gonna give my whole government name because I listen to this woman. She has
She speaks
been
truth.
so instrumental in this community, in so many people's journees. She's been instrumental in my journey. At 4 a.m., we are up there, tick, 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 and
there have been times.
Look, and
I
what are we
text with
doing
her
up
at 4
at 4
too.
a.m.?
Or like
Which is like a little crazy.
Well, see, this is the thing. This is what I do though. If I don't see somebody, because now with these damn algorithms, you can't tell what's what anymore.
No.
So if I don't see someone for a while, I'll send out a message saying, "I haven't seen you well. Are you okay?"
She
Because
did.
I withdraw when I'm not okay. So
Me too.
if I think someone may have withdrawn, and I think I sent you a message, is like, "I haven't seen you around. Are you all right?"
He did.
But I somehow managed to. I'm not sure why, actually. I don't have trolls.
Yeah.
I've only had 2 people make little snide comments, but there's basically nothing.
They tried.
I did not lose
They
my
tried
health
it.
when they tried. I don't know how I managed to stay under people's radar.
But Dr. Toomer, you speak so much truth, and that's what I tell people all the time, especially in my lives. I'm like, have you looked at the side effects of Tylenol and ibuprofen lately?
Yeah.
Oh, ibuprofen's nasty.
Absolutely.
Ibuprofen will shut your kidneys down.
It'll give you
nothing.
failure in a minute.
They will give you renal failure. You get renal failure, liver failure.
Yeah. My mom.
Bleeding disorders. I mean, it's like just
now
ridiculous
having
amount
that.
of things. Most of the medications that people take, what cracks me up is you have someone taking Adderall, talking about it's gonna give you. Do you know what Adderall
does to you?
No, Adderall is simply doctor prescribed methamphetamine.
Yeah.
It works, and it's a wonderful medication for people who actually need it.
Yeah.
Now, if you want to talk about a shortage that's being
It messed me up pretty
by
bad.
folks who don't need it, who are taking it, talk about Adderall. Don't talk about GLP-1.
Yeah.
Well, and I think most people are using it for. I'm sorry, most people are using it for weight management, right?
No, most people are
What?
using it for concentration. It
Yeah,
helps
Yeah.
you retain
right.
information better, even if you don't have ADHD. So the difference between a GLP-1
Interesting.
and Adderall, if you take a GLP-1 and you don't have an underlying glucose dysregulation, I always say, what happens if you don't have a headache and you take Tylenol for a headache,
Nothing.
but you don't
No.
have one? Nothing.
Ooh.
That's how GLP-1s work. But if you
And
take
that's a
Adderall,
short.
Look,
if you take Adderall, regardless of whether you have ADHD or not, your brain's going to respond. So I'm like, what happens when you drink alcohol? You get drunk, no matter who you are, if you drink enough of it. That's what Adderall is. It will just that effect. I mean, because or Xanax is another one. Benzodiazepines. People are like, but it makes me feel good. Well, yeah, it makes everybody
Duh.
feel good because that's what they do. So a lot of those, medications work on everyone.
And
No matter who you
I wanted to ask you, so a lot of people are now onto, they couldn't really get us with all the cancer, they couldn't get us with this, and now they're on the gastroparesis train.
Gastroparesis.
I would love to hear your thoughts because
Yeah.
as we know, one of the leading causes of gastroparesis is diabetes.
Exactly.
So
Right.
why? So and I understand there are people who are getting it. There are people who have got it. I had my negatives this week from the gastroparesis community because I addressed it. I said, no, I'm not scared of getting it from semaglutide. I'm more scared of getting it from eventually getting diabetes because I didn't take semaglutide.
Exactly.
So could you talk to the community about like why their fear for gastroparesis should be not as large as it from other things, because it is caused by medicines too.
Okay. One of the things that people also need to understand is a level of manipulation that clickbait is used for. And I mentioned this before. One of the things that happen is that nobody buys newspapers anymore. So all news is digital. And now what's happening, because it's all about money, they only pay writers based on how many clicks they get. So they create these sensationalized stories, these sensationalized headlines. Weight loss is a multi-billion-dollar business for a reason. They know there are a lot of people out there so they know if it's weight loss related, they're going to get attention. And so now Ozempic just happens to be the one, but Ozempic's been out for a while. It's not like it's new, and so when it comes to gastroparesis, what glucagon does, glucagon is actually naturally produced in our body. Our body makes glucagon. And what glucagon does is it slows gut motility. When you are predisposed to gut motility issues, GLP-1 will make it worse. If you have severe diabetes, gastroparesis is one of those things that can happen because diabetes, one of the things that diabetes does is it also causes nerve damage. Our gut is dependent on our nervous system to function. So when those nerves get damaged, it stops functioning. And so because there's those cases of women, 2 diabetics who are uncontrolled diabetics sued for gastroparesis, but kept taking the medication even though they couldn't keep anything down.
That part.
Thank you.
That part.
Are you really trying that hard to be thin that you'll kill yourself? Well,
ma'am.
But it's interesting though, because like the articles I read didn't even talk about how they were diabetic, and I thought that was concerning because none of the articles that I had seen were talking about pre-existing conditions, comorbidities, other medications that they were on that could potentially cause. I know, but like that's what I kept telling people.
That would be too balanced, and then you wouldn't have all the outrage. Why? It's like the outrage.
But that's why I was telling people you need to think critically. They're not telling the whole story. You have to. You have to think. You have to question everything.
I'm going to tell you that ship has left the port.
Girl, it's been gone. It's been gone.
Then when it comes to critical thinking, it's almost like there's this, anti-intellectualism that people are so damn proud of. You got folks telling me stuff, and I'm just like, so when was the last time you went to med school? And you're gonna argue with me.
That's the crazy part to me. Yes.
I know because my aunt's cousin, nephew, sister, brother said that she had this thing, whatever. And I was like, well, did they have
Dr.
this?
Google?
Well, I don't know. Well, did they have that? I don't know. Well, did they have this? Do you know that this happens? Especially with family medicine, because our job is to take all these random symptoms and pull it together to make sense.
Yeah.
When people start saying those type of things to me, I see it as a puzzle. And I'm like, really? It's like, it's problem solving. Anyone who goes into, well, usually people go into family medicine, they enjoy it, is because they love solving puzzles. And so anyway,
Dr. Toomer.
Yes.
I know.
Okay. Look.
Dropped it.
Okay. Look. Okay.
Uh-oh.
I listen.
Right.
You know that I listen to pretty much everything that you tell me. I do, but I have a question.
Okay.
And I
It's a big one, I think.
Yeah. Mm-hmm.
I read.
Okay. Look. So, Dr. Toomer, when the savings card ended, and we remember when all that happened,
Not too long ago.
and we've talked about we've all of us have talked about access to these medications and how we feel lucky enough to be on these medications. My question is two parts, because I know you're going to flow right into it. The first one is, we're seeing, because we're having such an influx of new patients of GLP-1s. We're seeing, well, I see all the videos and I see all the success stories, and I'm on IE 5 milligrams and I'm not losing anything. And I want to have those success stories too. And people are telling me to stay positive, and it's just and what and like, other than
this
swiping,
is what I would tell those people.
Go to my
thing and look for the pinned video of me in a flower dress. I addressed that, but no, really. So the medicine only can do so much, and so often what happens, cortisol is probably the only thing that can counter the medication. So if you don't manage your cortisol, you might as well just hang it up. So and then everyone has a different dose when that dose works. So it's not the same for everyone. Not everyone does the same thing. Not everybody tells the truth. So you don't really know what people are doing and what they've done or haven't done. And I know this for a fact because I have watched people who I know for a fact are on a GLP-1. People are like, oh my God, you look amazing. Oh, thank you. I've just been going to the gym.
Lies.
Good now, more than that.
Lies.
Or they're like, I'm not on Ozempic, but you're on Mounjaro.
They did it on a technicality.
They notice how people always go, I'm not on Ozempic. And I'm like, yeah, but you didn't say you weren't on a GLP-1.
That part. Okay. So
my thing is in this. So my feeling is this. If you're taking it, tell people, because that's the only way we're going to make this normal and stop the shaming around it. But you
could just carry a big cup that looks like a Mounjaro thing.
Or my candle. I have my Mounjaro candle that I love. That I think, and you got me on the journey. And you're the reason I bought it.
It smells good.
It smells like insurance issues.
Is it this?
Yeah, that's the one.
I love that candle, but we are seeing, and I know Ashley's seeing it, Kat is seeing it, Kim is seeing it, where no matter how much encouragement you get, people like the same people, and it doesn't have to be, but they're like, I feel left out. And it's
okay,
like,
this is the thing. Yeah. This is the thing. What you're seeing is a manifestation of how that person goes through life in general. It has nothing to do with their weight. It has nothing to do with the medication. It has to be whatever they've experienced in who they are up to that moment is how they're filtering their process. It's how they're filtering their experience. It's how they filter all of their experiences. And it's hard because, again, in this society, it is very socially acceptable to be mean and nasty to people who are overweight. So those people have been have been subjected to all sorts of behavior. What's the
Yep.
first thing that comes out of your mouth when someone gets mad?
You're
When you're
fat.
what is the first
You're a
thing
fat, whatever. Yep.
But
I mean,
That's what Rosie
Journey,
says.
Oh, I don't say
Rosie says that's what
whatever.
people say to her.
got mad at me because I wouldn't write for an opiate or something, whatever. That's the first thing
Yeah.
that was the first thing out of their mouth.
Yeah.
but Journey, a motto that I have had to tell myself is this: it is not your responsibility to validate every single person on that app.
Oh, absolutely not.
Because
Some people just need a mom.
because some people are like, oh, well, I've been on this dose and it's not working and blah blah blah. I'm eating this and I'm doing this. I'm like, listen, not every medication's made for everyone.
Nope.
Right.
That's true.
And not every experience is going to be the same. And you can tell, and our workouts are different, our diets are different. And I've always preached that I am not a pillar of health. If I'm craving McDonald's French fries, you can bet your butt I'm going to be in the McDonald's line to get myself some McDonald's French fries.
Oh, I got McDonald's today.
I have really had to step back from TikTok and some of the comments and be like, it is not my job to emotionally validate you for feeling or existing in a certain mindset. Because again, like if I had to do that for everyone, I'd be exhausted, and I can't do that.
Exhausted.
And I don't.
I'm exhausted. I'd like to learn from you, please. Thank you.
Hey guys, Dr. Angeline here with Surgical Arts and IBI Healthcare Institute. Let's talk about a very common question on why do I get thirsty while on GLP-1 medication? So we all know and talk about food noise now. GLP-1 medication, when it activates the receptors in our intestines, it also sends a signal to your brain telling you, you're full, stop eating, you're not hungry anymore. But guess what? The same function is believed to also affect your drinking ability. So same thing in your head tells you, you're not thirsty, don't drink anymore. So you actually have to actively try to drink more water while on this medication to prevent dehydration. Also, it appears that since most of our drinking happens a lot of times together with our eating, it's possible that at the same time as our eating being shut down, our water intake is shut down. So remember, water, 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 water.
Things that happened when I first joined TikTok, my daughters were mortified. They're like, Mom, please don't join TikTok. And Janine knows because I was very hesitant because they made me think like I was going into the lion's den or something. I mean, I was like,
they
You were a
did.
little.
So, but then they read the comments after my first video.
Yeah.
And my daughter was just like, Mom, I am really proud of you. She's like, people are really feeling seen and heard. And that's kind of what kept me going. But what I've seen is that I exude momness. And people are soothed. They comment as much on my voice as they do on my content. Or it's like, thank you for, it's just really just giving people permission to be whatever they are.
Yeah.
So but see, in medicine, it's part of my job to help people feel validated. So I don't mind it as much, but there's a way it can be done. Like there's some people who are just whining. Like I was like, if you're just complaining without a solution, you're just whining. I can't tolerate whining. But
me either.
But for the most part, though, we've just been treated so badly that there's a lot of anxiety, there's a lot of depression, there's a lot of self-loathing, and it's there. And you can say, there have been a few people who have really touched me, like who are just crying on video, and I always just offer, you can come and talk to me, and if they don't, then I'm like, okay, this is just performative. You have a whole, like I said one way, you have a whole doctor coming to you who I've been helping people lose weight for over 20 years, including myself, and I'm offering you an opportunity to chat with me. And
they don't want that.
They don't want the healing. We were just talking about that.
They
don't want that.
They're just performing, and it's just they want the attention.
The attention.
Like,
look, didn't I say that
but
we had that
good
discussion last
month
week
ago? I just said okay.
But
Okay, so
now, sorry, Journey. But the other
No,
thing, like
you're fine.
to kind of go to what Dr. Toomer was saying, like I noticed a huge difference between like people who are on name brands comments versus people who are on compound like me's comments. Like the compound, the anti-compound girlies are vicious.
Yeah.
Vicious because they're you know, and
Some
rightfully so, because I have seen some bathtub compound distributors on the app that give people who take the compound bad names. And
you're making Dr. Toomer just
I mean, we got,
but you know, someone like
You say
me,
bad stuff, Dr.
I
Toomer.
did a
We say
whole
bad
video
stuff.
on if you don't know your dose in milligrams, you don't know what you're
yeah.
getting.
I remember that 100%.
and if you're not getting a prescription, you don't know, you're not getting medication.
But then
Totally.
this is the other thing. And then I'm sitting here thinking our education system has failed folks because they can't figure it out, the math. They can't do the math. And I'm like, how the hell can you not do the math? So I'm like,
there's calculators to do the
spend a
math
lot
for
of
you
time
now.
doing the math, saying, you know, they're like, but I'm taking this many units. I said, but what's the concentration?
Yeah.
And they're like,
we actually had Dr. Myra on the compound episode, and
milligrams per milliliter.
Yeah.
And if you know the milligrams per milliliter and you know how many milliliters you're taking, then you know how many milligrams
you're taking.
But if you don't know how many milligrams you're taking, you don't have a clue. And what a lot
it
of
should be on there though, right, Dr.
No,
Toomer? Should like a prescription, it should say
that's the
what
thing.
milligrams.
It does say
that don't have it.
But yeah, see, the prescriptions that I get,
only ones.
I worked it out. Like some people will give me the numbers and I'll do the math. And I'm like, that's not even a real dose.
Yeah.
But Kim, let me tell you,
dose is that for this medication.
Kim, working at the clinic, it will be on the bottle and people will still be like, how many units do I inject? And it'll say inject 50 units of XYZ milligrams.
This many milligrams.
And so it really, people just don't, they're willfully ignorant.
One of the things we had people with compounding had to say units because otherwise people would just screw up what they were doing. But what it's done is that it's made it so that people have no clue.
Yeah.
Well, and every compounding pharmacy has different units based on their product. So like depending if you and I are going to two different compounding pharmacies, our units and our dosage could be completely different. And I think that's where people are confused.
That's how you can tell if you have a legitimate compounding unit, because if your doses are not in the FDA approved dose of that medication, then it's not legitimate. So no matter how many units you have to take or not take, it still should be for, I say semaglutide, people say semaglutide, but it still has to be 0.25, 0.5, 1,
exactly,
0.7, 2.4.
And that's why I don't talk to people on units. I only talk to them in milligrams.
Then who knows? And so the only reason I was very anti-compound early on, very anti-compound.
Yeah, I've turned a corner
because
too.
Me too. Because I've seen too many.
It's just fear.
Take advantage. Yeah. But when they started, when suddenly people who had benefited from the medications, who have felt like they said been to the promised land, and then suddenly had it snatched away from them, I was like, I've got to find one I trust, because I can't. People were suffering. I mean, it was
people are suffering. Yes.
I mean, it was so heartbreaking. My arthritis stopped bothering me, and now I can't get access. And I can barely walk because I was almost in a wheelchair. Now and I'm just like, so that's really why I found one that I trust, who now who will have tirzepatide by October at some point. But I ask every single person, if it doesn't work, you tell me. If it doesn't work, tell me. Because I want to make sure that, because they could decide, they may decide to get greedy and start and change their formula.
Yeah.
If I don't get
very good point. Yeah.
But I actually don't. They won't go.
It's just tough because when the savings card ended, like you said, the access, people and people are still suffering because now they're getting the letters of effective September 1, effective October 1, your coverage, even with a approved prior authorization, coverage ends.
I know.
And it's like, whoa, wait a minute.
I've never seen this level of anti-medication from insurance companies ever, not since opioids. I honestly have never seen any insurance company crack down on a medication like this ever.
Yeah.
And they said that they were going to do it. They said that they were going to do it.
I know
spring,
they are, because
and it doesn't
because
make
of
it
the
right.
cost. It's, I mean, if you ever have to ask why, follow the money. And
Totally.
so it's because of the cost. But the thing is, though, it's part of the cost, and it's because they don't care. There are other ways that you can get the same result, but it's a lot more difficult. And why make it so hard for people?
Mm-hmm.
Do you think it's the racial disparity?
Really, I've never seen, we're going after prescribers for prescribing a medication off label. We didn't. If we didn't prescribe it off label, they never would have known it caused weight loss in the first place.
Yeah, exactly. Hello.
Look, I mean, how do we know? How did we know that an anti-seizure medication helps with bipolar disease?
Yeah,
because we were using it off label.
Yep.
How did we know that metformin could be used to lower androgen levels in people with PCOS? Because we were using it off label.
Right.
Yeah.
But
I mean, so that's just BS. When they say leave you off label, that's just, it's not illegal. And it's not malpractice.
Look,
so stupid.
Don't get me on my soapbox. You know me.
But with the savings card ending, and I don't see compound going away anytime soon. I don't think we see that.
But what they're going to do, that this is what they did. They tried to shut it down by making it illegal.
Yeah.
So what they did is they used the FDA rules against them. So that's why so many of the compounds have vitamins attached, because now they're supplements instead of medications. And so they can't, but they had to do that because it was really it was boiling down to malpractice. If it just didn't help people, I mean, if we didn't do that. And so, I feel sorry for whoever has to edit this, but anyway. The thing is, we just don't know. All bets are off, because there's nothing normal about the way insurance companies are behaving. There's nothing normal. Well, the pharmaceutical companies are acting like they always do.
Yeah.
But there's no the level of animosity and hostility around these medications and people using them. I've never seen it. I mean, we didn't even see this even with people who were dying of opioid overdoses, who are still dying of opioid overdoses. Nobody's talking about that.
No, talking about this.
They're
God
just
forbid.
Like,
we wouldn't want fat people to get better.
Barely.
I'll just give you a preview of the next TED Talk, though. Is that what this is? I haven't decided what I'm going to if I'm going to call it the new Jim Crow or the new apartheid, but that's essentially what it is.
Look, ma'am.
That's what this is. It's the haves and the have-nots, and there are people who are gatekeepers who are telling those who don't, you can't drink from this drinking fountain.
Yes.
Oh,
it's awful.
You can't come through this door.
You're saying the quiet part out loud.
Yeah.
Look. Say it for the people in the back. Say it for the people in the back, because so many minorities, so many Black and brown people, and I was one of them. I didn't even know about Mounjaro until December 2022.
But it's not even then. It's about anyone who isn't privileged enough to have access.
Yeah.
I worked in underserved populations my whole career until I just opened my own practice.
Good.
And even then, I'm still considered a semi-rural area.
Yeah.
And it is all about money. It is money, and if you don't have it, you don't get it, and that's all there is to it. Because In South Carolina, we have one of the highest obesity rates in the country.
Yep.
Yeah.
And
you all state system really doesn't even want to cover birth control.
now
GLP-1.
Medicare and Medicaid are covering Wegovy. Medicaid is covering Wegovy for adolescents.
Oh, really?
But it's still
really?
But the PA thing is like,
Oh, I bet. Yeah,
but,
we had an episode about it. Yeah.
But one of the things that I've decided to do is to start a nonprofit so that people can get weight health treatment through grants, because that's the only way we're going to be able to get it.
Yes, I love that idea. How can we help?
But we
seriously.
That's the thing. Why do we have to do that? We should not have to.
I know.
Well, and it's interesting that you say that about you living in South Carolina and like all of, the racial disparity that Janine was touching on.
Yeah.
Why is it? I mean, and we know why it is, but it's very interesting to me that, we're kind of focusing on white celebrities taking Ozempic, where in which that we are not focusing on Black and brown communities who would probably benefit from it, from their higher predisposition for diabetes, hypertension, et cetera, and underprivileged communities where we're seeing obesity at a higher rate than we would see, obviously in like Orange County, California.
Yeah.
So where are we going to and you would think that big pharma would be like, oh yes, more medicine on the street, the more money we're making, but it's just not like that.
Yeah.
No, so this is what it is. This is what happened. The reason there is a shortage was, and this is something that what they did is they divided and conquered. They pitted us against one another so that nobody knew the truth. And essentially what the truth was, the FDA shut down a couple of their factories for contamination. And that's why that's what started the shortage. One. Two, the other is they got greedy. And so instead of just making one medication with two indications, they made two different medications. So they can't make them in the same factory. They have to make Wegovy in a Wegovy factory and Ozempic in an Ozempic factory, instead of just calling it all Ozempic and saying you can use it for weight loss and for diabetes, which is, I think, what they're going to do with Mounjaro. I hope that's what they're going to do, and they don't name it something else stupid. But, and so what they say, it's not sexy. That's what it is. That's what it boils down to. Having some celebrity. One, we're in a celebrity obsession culture anyway. I mean, look at the Kardashians. How the hell did they become famous? Well, I mean, it's just,
they're very pretty.
Well, I did watch.
They're pretty,
very shiny. You're like,
yeah, they're shiny. But I'm just saying is we are in a society where those things are celebrated. So of course, celebrities, and then you have these. My doctor gave it to me, and I didn't know what it was. You were injecting something, and you didn't know what you were.
But you didn't know.
Lies.
Come on,
Look, lies and fallacies, honey.
I mean, I'm just like, so you really took a medication, dialed it up, put a needle on the end of something, injected it in, and I didn't know what it did.
Girl,
I didn't know what it was.
Look,
really?
Child.
Yeah.
Okay.
Or again, the one, I have a hormonal imbalance, but I'm not on Ozempic. I was like, that's because you're on Victoza or you're on yeah, you're telling the truth. You're not on Ozempic, but you're on some GLP-1. It's obvious, but it's just, again, it all boils down to our bias and prejudice against obesity, overweight, and what we consider attractive in this country.
Yeah, for sure.
So, and we do not consider, and again, who are considered attractive? The celebrities who become celebrities are the ones who we deem attractive, and so they're the ones who get the attention. And half the time, they're not even using the medication, but it gets clicks and it gets headlines when people say they are. And then you have people like, Bethany Frankel, who has made millions.
Skinny girl
had the nerve to open her mouth about people taking Ozempic. Why? Because it's taking money out of your pocket?
Yeah.
The only thing I could think of.
Yeah. Well, I guess nobody needs skinny girl margaritas anymore. If
here's the thing. She could have flipped
her one.
From a marketing person. She honestly could have been like, my stuff is for the Ozempic girlies. This
Yeah.
stuff, or the
Yeah.
Ozempic.
Bam.
Yeah, but
For her, because for
Would have
her
been
marketing to be
genius.
so
Exactly.
smart, she really
Yeah.
did fail the
we
test on this.
failed on that
Yeah.
one. But
Yeah.
anyway.
It
Because
was-
I actually really like a skinny girl margarita, because what I've noticed that when I drink on semaglutide, because I do drink on semaglutide,
Most
is that if
people
I
do.
have something too sugary, I
Mhm.
feel terrible. So I
Yeah.
need to have something lower in sugar when I'm drinking.
Yeah.
And that was a really good option until she started
It
going
was.
crazy.
It was.
Well,
And-
this is the thing with drink, and also with alcohol, because alcohol and Ozempic kind of hit in the same, they're metabolized in the same way. And so
Mhm.
that's often why people really just either who used to be addicted to alcohol now aren't,
Yeah.
because they no longer need that part of their brain that
Mhm.
wanted that drug is getting it naturally through the medication. And then, but also they start competing. And then when it's in your system, if your gut motility slows down and you have alcohol sitting in your stomach, it tends to want to come back out. So, yeah.
Haven't had that yet, but
Yeah.
The wine has not done that to me.
I was like, mad because I was like, I love
Again,
my
I
glass of
don't.
wine, but it's like it's hit or miss now. I'm like,
but
nah.
it took me a while. It took me a while to be able to like drink a beer. I can drink wine, I can drink like a vodka rocks, but drinking a beer is hard. Like it's hard on the stomach.
Yeah.
It's
Yeah.
like food.
Well, I see your message, Kim. Yeah. I was like,
I feel really bad.
You're good.
But what a great conversation, right? Like
This is fantastic.
we talked
yeah.
about so many good things.
Definitely.
You know?
Without- who does
What am I
the
going to call this episode?
Kat, you do
Oh,
the editing?
producer.
No, I
please.
don't. I don't.
No.
I was to say, who knows?
I may have to pay someone. I may have to get a
Fiverr, and you're like,
yeah, go on a
definitely
Fiverr.
not me. Definitely
No,
not.
you just release it
No.
in a part 1 and
edit
part
my
2.
own business.
I agree.
I did that last time. That's actually super smart. That is what I'm going to do.
It's a really
Thank
great
you, Ashley,
conversation.
marketer.
Yeah.
Part 1 and part 2.
Oh,
We
yeah.
got like 2 marketing people right here.
Yeah, we
so.
do. Yeah.
Part one, part two. But there's also what's it called? Of course, now that I'm trying to think about it, but what it is, it's an app that transcribes your whole video,
Yeah.
and then you can go in and remove the language.
Oh, yeah.
and it
I have that.
automatically cuts the video.
But like, there really wasn't that many
Yeah.
like womp womps. There was like, I mean, like honestly, it was all really good.
No, it has flowed.
Like literally, the worst thing that happened was we all went,
what you did last time. I went in and
you know?
took all of the little snippets you did.
Oh yeah,
You're supposed to.
we'll send
Yeah.
it to you. We'll send it. That's our new thing.
Yeah.
When we have Lydia now, she does our socials. So she's been making really cool like
Mhm.
yes, they like look really nice, doing them in
stuff, yeah.
camera and all that. They
Although
look
I have to
fancy.
say I'm a bit salty because I offered my services when Rosie O'Donnell was going to be on,
Oh
and
my
I
God,
was
did you-
turned
did you-
down flat.
It happened
like-
like that.
I know.
Like
I was
that.
happened really
It was the
fast,
next
I was like, you know what?
day.
I'm going to shoot my shot. I love Rosie.
It was. I literally got your message after the episode. That's how it went. Yeah, that's how it
If you
went.
need
It was
a
the
doc- like,
next
if you need a
day.
doctor on that episode,
Agreed.
Hell yeah, I would have totally had you on that episode.
There were so many
100%.
moving parts. It was
Oh,
kind
I
of
know.
wonk. I was in France.
Yeah. Yeah. No,
We were
like
all
I
over
was
the
on
Dr.
a
Rosen
standby.
I did.
had just
I
been
used
on
to
her
do
show,
interviews
and he
of
just jumped
actors for
on.
a show I used to watch.
Yeah.
Are you all familiar with the Discovery of Witches?
Yeah,
Discovery of
It's
Witches.
interesting.
Yeah,
Yeah,
so I
it's-
did.
yeah, it's
I
good.
have a YouTube channel where I interview the producers and the
Cool.
directors, some
Oh.
of the actors and whatever. And yeah, it was just like constantly juggling balls in the air to get the schedules.
Yeah.
Yeah.
The
schedules.
schedules is the worst.
Yeah.
So yeah, I
One day
yeah.
I'll have like, I don't know, somebody that does that. I don't know.
Yeah.
Or maybe I'll just won't have to work my job anymore and I'll be able to do it. I don't know. We'll see.
Look,
More
hey,
sponsors.
Well,
Got to keep it
I'll
going.
let y'all know next time I'm in Atlanta. I only live like 2 hours from here.
Yeah.
No, but I would
live
love
right
that.
up by
Let's do
20.
it.
I live right up
Ooh,
by
we'll
20.
do a whole thing.
I'm there all the time.
Yeah.
Together.
Love it.
All right.
Okay, awesome.
I will be driving through Atlanta the couple days before Christmas because we go to our cabin in Topton. So
ah,
Hang out.
Yeah.
When it's
Really?
done.
Let
Oh,
me
it's
know.
gone.
That would be
Probably
fun.
be in
Because isn't
Raleigh.
there
Wouldn't
like
it be
a
so
get-together-
fun?
Isn't
Let's
there a
do
get
it.
together in North Carolina right now?
oh,
No, we're in
Nashville.
Tennessee. We're
Nashville.
going to Tennessee. Yeah.
Okay.
Yeah, Nashville. Yeah. Yeah.
Yeah.
They're going to do one there, and I'm going to go and interview all these people. I'm going to be real tired. But I like I said, I'm excited about my life
But
every
you
day.
know,
I don't know how to not love it.
I
I'm
don't say
tired,
one
but I'm
last thing,
happy.
and then then we'll go.
Okay.
But there's also one of the things that's starting to happen is that I'm actually starting to get backlash.
What?
Because it's like I have to prove my street cred to talk about weight loss and weight health.
What? Well,
Yeah.
you know what?
What?
This helps. So
No, I know. But what I'm
Yeah.
saying is, like, if people don't know my story, they just like, well, who the hell are you to talk about XYZ or
Ah.
can't say anything negative, can't say anything in any kind of or perceived in any way as being judgmental or whatever. Because it's like, but I have seen it though. There are those like kind of born again thin people. Who are
Yes,
like
the
born again
worst.
Christians. It's like, you know, it's like once it's like they kind of go overboard and they suddenly start becoming
Yes.
judgy.
Yes.
And I'm starting
Yeah.
to see that.
I lost 70 pounds or 100 pounds, and I
why
have to
can't
keep it
you
off.
do
And
it?
you know what I say to them? I am so happy for you,
The queen
but
bee
I'm thinking in my
syndrome.
mind, you're probably going to gain that back. And I'm very, very sorry, because maybe if you got on GLP-1, you wouldn't. Like, maybe you could do it now. Like, you know what I mean? Like, I'm sorry, because you must be suffering. You must be white knuckling. Now, there are some people that may not be, but
And
I
then all
can't
the dogs-
imagine.
God, the
There's a
dogs.
reason you gain it back. There's something going on here,
Yeah.
you know? Yeah. Anyway, what we say? Wait
Well,
between
this
the
was
ears.
great.
Wait between the ears.
I
Yeah,
know.
it was such a good conversation. And we
Right.
will do part 1 and 2. And I love that, because we're trying to make sure we take the holidays off. So now we'll have content for that. See, it all worked
Right.
out, Dr. Toomer.
We love it.
And it
And
wasn't
that way we
I
can
didn't
have more
plan that,
time to hang out
but
when
I
you're
was
in
hoping.
Atlanta.
Yes.
You gotta do
Yes, I would love it. Let's all message
that. Yeah.
and
I mean, 'cause
decide when you're
we're
gonna.
all
Yeah.
on the East Coast, right?
Yeah, I live in
Actually, where are you?
I'm in Jacksonville.
Jacksonville. Yeah, in
Jacksonville?
Florida. So yeah, this is perfect. It's like the perfect intersection. I love it. All
Yeah.
right. Well, it was
All right, y'all.
super great. Thanks so much for coming,
Great.
guys.
Thank
We
you so much,
appreciate it.
guys.
And I will
Good
exit
night.
you stage left.
Thank you.
And we'll talk soon.
Thank
Bye.
you.
Oh,
Oh, that was so good. I love it
Oh
so
my
much.
gosh.
that could have
I
gone all
love
night.
it.
We just had a
Oh, I
little
could too. Oh, I'm
extra
so like
drink,
that.
extra
Yes.
water.
We all like totally vibe, and I love Dr. Toomer so much, for sure. Yeah,
She just
I
like
love her.
laid me
She's
out
just
with a couple of her
I
one-liners. I was
just
just like,
love her. She's so wonderful. I'm so
done.
glad we could get her back on, because it was funny, because I was like, hey, will you come on? She's like, what are we going to talk about? I was like, well, we always talk about. She's like, okay.
We talk about all the
Exactly.
things.
We're singing the
All
song,
the
Dr. Toomer. We're singing the song, and we're going to make it a hit, because that's how you do it. It's marketing.
Exactly.
All right, friends. Well, let's do our classic sign-offs, since we've been talking quite a while. It's gonna be good. I'm gonna get an editor, make it 1 and 2. That's the way to go. A and B.
I like that.
Yeah.
Mhm.
Anywho, we'll have to like think about what the title should be. I don't know. There's so many good things. Anyway, I digress.
Look,
All right.
look,
My sign
none
off
of your
tonight
business.
is super easy.
I like none of your. It's none of your business.
It's none of your business.
None of your
None your business.
None. None yet.
Yeah, it's a pretty good one. None your business. GLP-1 edition.
None of your business
Yes.
and mind your business.
Mind your business. GLP-1
It's a good
edition.
one too.
I don't know. We'll get something cute.
We will.
All right. Well, I'm going to make it easy, because I know it's late. Mine's going to be, you're not alone. It's not your fault. And I'm always going to be an hasta pasta. So what about you,
Heck
JT?
yeah.
Anything new?
Hey, again, it is a marathon and not a sprint. Lord,
right.
Lord. And you know what? There's magic that happens when you put pen to paper.
That's so true. I love that with the journaling and
Gratitude
stuff.
list.
Yeah.
Heck.
What about you, Kat? Everything still hurts, Carter.
Same old. Everything still. Yeah. You know.
Yeah.
That
Still.
massager worked on my feet though.
Still. That's good. I need it for my neck.
Old
I got
standard.
one.
Always
Yeah.
be yourself. Never give up, and don't ever
Yeah.
put too much flour in your
And
brownies.
your brownies.
That's right. That's right. And we will see you guys all next week. And actually, when you watch this episode, you know, you probably just saw part 2, which is good.
Yeah.
I have a little bean footage, and then we're going to go out. So everybody have a great week, and we will see you next week.